It's Ronnie Klein for Day 2 of the Geneva Association Health and Aging Conference 2020, kindly sponsored by Prudential Financial. Thank you again, Prudential, for sponsoring the conference. I won't take a lot of time talking about the agenda for today. We're a little time constrained by the speakers, so I'm going to introduce very quickly Adrita Bhattacharya. Craven is the Director of Health and Aging at the Geneva Association, and she's one of the best health experts that we know, and she's going to lead a great session today. I'm going to turn it right over to Adrita so that we can get started, and I will come back to you after the session and do a summary. Thank you.
This is our second half day of the conference, as Ronnie mentioned. For those of you who couldn't join us yesterday, a very warm welcome. And also, I would take this opportunity to quickly do a recap, but it will be a really quick one because I know Ronnie is going to elaborate on this a little bit more later. Yesterday, we kickstarted our conference with the subject of aging. We focused the first few sessions on really understanding the phenomenon of aging. Then we moved on to our second session, which looked at the nuts and bolts of COVID-19 related mortality, its relationship with aging and the demographic profile of those that have been affected, who have been affected by COVID-19. And the final session yesterday looked at how the focus of insurance research and practice is also shifting when it comes to aging to not only address financial wellness of people as they grow older, but also to tackle some of the broader issues that relate to our lifestyle, our social environment, which often defines the course of our lives and therefore our ability to be productive and save for the future as we grow older. Today, we focus on another key aspect of our conference, which is the health aspect of our conference, health and health systems that many speakers yesterday alluded to in their talks. Allow me a couple of minutes just to set the scene for you. Aging and the rise of non-communicable diseases is not a new subject by any means. About a quarter of the world, people currently live with, a quarter of the global population, let me start again, currently live with a form of chronic illness. We know they account for 70% of the global deaths. We know about 1.4 billion people are at risk of developing non-communicable diseases purely because of inactivity. On the other side, we also see a meteoric rise of mental health problems, where about 13% of the global population are said to suffer from some sort of a mental health illness. We also know people with dementia, living with dementia, is set to treble to 150 million over the next 30 years. And these statistics really go on. But there was a sudden inflection point late last year, and that was brought about by the COVID-19 pandemic. And it has exacerbated every single one of these areas. We know people who have suffered the worst fate are ones who had an underlying health condition. We are far from knowing the long-term health implications for those who contracted the virus. And we also know a vast amount of other types of NCD, be that be cardiac diseases, be that be cancer, as well as mental health problems are currently going unnoticed because we are totally focused on COVID-19. And we know these problems are likely to become bigger and come back and hit us at some point over the course of the next couple of years. This begs a question. As an industry who specializes in foreseeing and managing risks, what happened? And this is where this particular session that I will be moderating comes in, where we will be discussing some of this provocatively but constructively amongst friends to really understand how we really need to think about health systems issues going forward. With that, let me introduce to you my panelists, my distinguished panelists today. I have with me Dr. Gaudens Silberschmidt. Gaudens is the Director of Health and Multilateral Partnerships at the World Health Organization. Prior to joining the WHO, Gaudens was the Swiss Ambassador for Global Health. Gaudens is best known for his advocacy around prevention. And needless to say, Gaudens has been very busy with COVID-19 related firefighting, which I'm sure he will talk to us about shortly. I also have with me Dr. Ali Al-Shalabi. He is the Deputy Chief Medical Officer for AXA One Health. In addition to being a medical doctor, Ali has been spearheading AXA One Health, which is AXA's flagship integrated healthcare program. And it is particularly important to discuss this here because of its emphasis on prevention and primary healthcare, which we really look forward to hearing about how what we will be discussing throughout the course of this conference has been put into practice by initiatives such as AXA One Health. So without further ado, Gaudens, I would like to kickstart the conversation with you and really ask you to reflect on three critical areas with your multilateral hat on. One is, why was the world so unprepared for this crisis? Number two, why do you think the prevention agenda lags behind when it comes to both the public and the private sector? And then finally, also give us some hope as a result of this crisis. Where do you think the innovation is really happening in health systems, in this NCD space, in this prevention space, especially those that are done in partnership with the public and the private sector? So you have about 12 to 15 minutes, Gaudens, and the floor is yours. Thank you.
The OECD, in its economic analysis, is running a system of health accounts for its member industrialized countries. According to the OECD, only 2.8% of health expenditure are on prevention, public health measures, and preparedness. This account might not cover all health promotion investment outside the health sector, but even if the true average is 4% rather than 2.8 into the 3 Ps, it's a tiny fraction of health expenditure, of mostly curative health expenditure. My hypothesis is that health promotion, prevention, and preparedness would provide a higher return on investment, but attract irrationally little public and private investments. I find it difficult to come up with a rational explanation why the airline industry was neither prepared nor insured for what was one of its biggest knowable risks and is now an existential threat for them. I was back in March with Ronnie in a conference. We discovered the airline industry simply was not insured nor prepared. So starting with prevention and health promotion, does it work? Yes, it often does, but people in the health sector are mostly satisfied with evidence convincing their peers and do not really enough to convince financial decision makers outside the health sector or rally public opinion and action. Here is a list of some of the so-called best buys, measures with clear efficiency and effectiveness. Tobacco and alcohol legislation, taxation, control, reducing salt, replacing trans fatty acids, raising public awareness on healthy diets, physical activity, mass media awareness, road traffic injury prevention, heat wave plans, healthy employment programs and mental health in the workplace, violence prevention legislation, prevention of postnatal depression, and the list goes on. So there are many proven cost-effective measures. But we do not invest into it. Let's see what we can do to start to invest more. Now turning to the epidemic preparedness. The current COVID-19 pandemic has shown to everybody that preparedness and early strong response matters, but we haven't done it. I'm sure that countries such as Canada, Switzerland, and New Zealand have a much higher likelihood, and that applied already before the pandemic, to be affected by a major epidemic with severe health, economic, and societal consequence than by a war or a major attack. Yet they spend year after year out on defense and multiple from their preparedness and health security. Military spending in Canada is 22 billion, Switzerland 5 billion, New Zealand 4 billion. I don't speak of the 750 billion in the US, 237 billion in China. Worldwide military spending in 2015 was 1.67 trillion, 1,676 billion, while the worldwide spending for global health security in the same year was 11.8 billion. So 142 times more on military security than on health security. And compare it with the figure of the failure. But what are the costs of the outbreak? And I deliberately go backwards in those where we have, in hindsight, more visibility. SARS in 2003 affected 8,000 persons, killed 774, and had an economic impact of 52 billion. So it was much more an economic crisis than a health crisis. The Ebola outbreak in West Africa in 2013-2016, in the three countries, Liberia, Sierra Leone, Guinea, also took the world ill-prepared. It affected 29,000 persons and kills 11,300. In long-term, economic direct and indirect costs were estimated at 53 billion, and 3.6 billion were spent on international support for the response. We had another outbreak which we very quickly responded to in the western part of DRC, and then a more severe one in the eastern part of DRC, in the North Kivu province, where we managed to control it in 18 months, despite having to act in a civil war. Those problems, however, are not specific to low-income countries. In 2015, a single imported case of another coronavirus, MERS, the Middle Eastern Respiratory Syndrome, into South Korea, affected 186 people and killed 36, as their health system was not prepared, and a lot of preventable infection occurred, including in hospitals. According to the Korean Economic Research Institute, the economic cost was an outside 8 billion, mainly due to avoidance response. That's, I think, an important point. It's not just what government are doing, but how the population is reacting. Now South Korea has learned the lesson, was better prepared, and responded much better to the COVID-19 outbreak, as did New Zealand or Finland. But many other countries did not learn these lessons. They've also shown that there is no dichotomy between health and economy. And I think that's an important point I want to stress. We cannot overcome the pandemic without, or have an economic recovery without having the health problem under control. So many people say, oh, we have to balance the two. No, we have to tackle both at the same time, because without controlling the pandemic, there will not be an economic recovery. If you want to protect the economy, the only way is to protect health. The world and most countries underinvest in surveillance, in laboratory capacity, in preparedness and pandemic planning, in training, in research, in vaccine development, in antimicrobial resistance, in essential commodity stockpile, and so on. Why doesn't it count for the insurance industry? My first question is, why does your business model work that people invest into insurance policy to prepare for risks that occur years or decades later, or might even never occur? Why they do not invest, or invest too little, in health promotion, disease prevention, and epidemic preparedness? So what is in it for the insurance industry to work with us in general, and then specific on pandemics? Increase healthy life expectancy seems to be a good business for life insurers. So I think we have a common interest there. Both a healthier population and epidemic preparedness is good for the economy and good for the insurance sector. Reducing and pooling or diversifying risk seems to be your core business. So what could you do? How could you bring that in? Make preparedness as part of investment decision. A country investing in health and preparedness will thrive economically and perform economically better. If markets and your capital investments decisions are included, this factor, you provide governments incentive to make the right choices. Invest into healthy literacy of the population and your customers. Share your analytics and modeling capacity with us to jointly make the case for adequate investments in preparedness and prevention. Help us frame prevention and preparedness in a manner that becomes insurable. When a risk can be insured, the industry tends to create incentives such as lower premiums for prevention and preparedness. So there we can really jointly shape the future to get a better investment. How can we work closer together to conclude? We could cooperate on research topics such as economy case on health promotion and disease prevention. How can we together convince government to do the right investments and create incentives that the markets work to improve health? The insurance industry and WHO are in the business of data. How could we use synergies between our data, your data, and your data analytic capacity? Many cost-effective public health measures face a scaling crisis. We must invest into implementing science and scaling science. And there should be specific insurance product. So how do we create products for the most vulnerable industries, but also specific products? Imagine a positive effect on reducing the use of antibiotics and generation of antimicrobial resistance by replacing antibiotics in preventive use by an insurance product. Climate change is another case in point. So let's work together that this time we learn the lesson and start investing in a rational manner into prevention, health promotion, and epidemic preparedness. Thanks a lot.
Thank you, Gaudens. That was very succinct, but also it had a lot of rich content that will take us probably a whole day to digest. I think there are many valid points that you have raised. One of the areas I've just picked up from your presentation was really about, why doesn't the insurance industry invest in prevention? And that really takes us to our next panelist of this session, Ali. Well, perhaps it's trying to do so now that it probably didn't happen so much before. And Ali, let me bring you in. Let's look at the practice of how the insurance model around healthcare and life is also evolving. Again, let's focus on 3 areas when you talk. Perhaps give us an idea about what led AXA to do AXA One Health. What's the genesis? What led to the genesis? Then let's perhaps give us an insight into the model, and finally give us the lessons learned. What in your view is working well? What are the areas that also require further attention? Again, you have about 12 to 15 minutes or so, perhaps more on the 12, so we can really have an interactive session with our audience after these presentations. So over to you, Ali. Looking forward to what you have to say.
Perfect. Thank you, Adrita. I hope everybody can hear me well. Thank you for inviting me, and I really enjoyed Dr. Silberschmidt's talk, and I think that what you will hear really will complement all the issues that you raised. I'm even tempted to try and answer the areas of cooperation that you mentioned at the end, but I will leave that for our discussion. So Let me give you a little bit of context of what One Health is. We are a project within AXA's International and New Markets. INM is an entity that is really widespread. We exist in 32 countries in 4 continents across the globe. We've got 15,000 employees, and INM alone brings in, or brought in last year, 6.8 billion euros in revenues. The core purpose of AXA really is to act for human progress by protecting what matters. And when it comes to health insurance and health in general, the health and the well-being of our clients is really what matters to us. AXA is generally a strong player in health. They're one of the biggest insurers outside of the United States. And the health insurance within INM accounts for about, has had a 14% increase in the revenue from 2019 compared to 2018. We're also a responsible insurer in the sense that we have been praised for our efforts in divesting from fossil fuels. That's on the environmental side. And we've also, since 2015, completely divested and excluded assets from the tobacco industry. And like Dr. Zilberschmidt said, we leverage the power of our data and technology in any of the solutions that we bring forward. So the strategy that we have in emerging markets is where there is a low insurance penetration, and the existing health systems leave a lot to be desired. A lot of them are unsatisfactory to the client, is to provide healthcare solutions that really address all of the shortcomings of these healthcare systems. So in July 2019, we introduced our new expansion, which encapsulates 2 real concepts, which are the payer to partner, where we're moving from just being a payer of claims to partnering directly with our client, and the vertical integration, where we gather all of these services, or as many as possible of the services, under one roof. And this creates a kind of a health ecosystem that caters to the client, and we have launched it in the form of our own medical centers. This combines, like I said, within vertical integration services that are normally delivered in different entities or different providers. It offers a holistic approach to health, and I'll speak in a while about how this is important to aging. And it also simplifies the healthcare journey for our clients. Now, AXA One Health is 100% owned by AXA, and its value proposition is a safe, a standardized and a high quality care for the client. We deliver it along 3 lines. We have the traditional brick and mortar physical clinics. We have a strong digital component with teleconsultation and virtual clinics. And we also have a third, which is the remote care or healthcare on site form of service, which in the context of the elderly would be home care. And this is complemented also with remote patient monitoring, with a very strong digital backbone of an electronic medical record that will combine to link all of these centers and these modalities together, as well as an application for easy interactivity and devices that are connected to the internet, so the IoTs. The way we engage with our clients is, again, along 3 lines. So we do the reactive care, the traditional, where people are unwell or they are seeking any kind of service, and they would come to our either physical or digital clinics. But we also have interactive care, which is basically along the chronic disease management programs, and we have these in place for the top 2 at the moment in Egypt, which are diabetes and hypertension, or generally cardiovascular diseases. And then we have the proactive care, where we want to actively reach out to our clients, and even from a preventive point of view, with coaches that are either nutritionists or health coaches, to keep our clients healthy. Our focus is on primary care and with some selected specialties, so that, again, we create a seamless experience for our clients. And this primary care and holistic approach to health that I alluded to earlier is really what's important when it comes to aging, because you have a collection of general practitioners of family medicine, as they are called here in Egypt, nurses, dietitians, physical therapists, that offer an all-rounded approach to healthcare and with aging. And we define the successful aging as somebody who has an active, connected, and meaningful life, and not just somebody who is sensing or reacting to any kind of disease. And in that sense, also, we've got a very strong training and formative program for our healthcare professionals. We've just kickstarted a partnership with one of the leading universities in Egypt on the elderly care to train doctors, nurses, and allied healthcare professionals on delivery of care and also for care coordination. So when there is an element of care that we aren't able to offer within our centers, that we were able to then refer to these centers. Maybe I'll touch on the point of Dr. Silberschmidt about what, as insurers, we do to address the obvious impact of COVID-19, such huge impactful events such as pandemics or natural disasters, because it really comes in under the same umbrella. I would summarize them into two main domains. So we deal with risk, obviously, and we touched on the idea of mutualizing risk. Although that is not my forte, I would be wearing the doctor's hat here. But we also are very keen on addressing the root cause of the problems, and we want to genuinely provide solutions to them. And that would be through research. And here I'd have to highlight the very strong point that we have, which is the AXA Research Fund, which is the philanthropic arm of AXA Group that was created in 2008. And works along research lines for environment, for health, socioeconomic topics, and any new technologies, and has so far invested over 200 million euros in research, has worked over 600 projects with over 60 nationalities worldwide. Adrita, I think maybe my few minutes are up and I might stop here. Thank you for that.
Ali, thank you very much for a very, very insightful explanation of what AXA One Health is and about the ambition of AXA One Health. And now you really are redefining the space of what actuarial insurance can do in the prevention space. So thank you for that. I really am keen that we have a very interactive session here. This is uncharted territory for many of us in actuarial insurance. And I'm also conscious that we have about 80 participants on the call. And they come from all walks of life. So I would like to open this up to our audience to ask questions. My preferred option is that you raise your hand and we unmute you, so you can ask a question to the panelists directly. If you're feeling a little shy to start off with, feel free to use the chat box and send us your questions. While that is happening, perhaps I can kickstart this with a little bit more open and fluid conversation. We talked about several areas of collaboration, Gaudens, and I'm coming to you to start off with, because you are the guy who deals with partnerships in a large multilateral organization like the WHO. So you have been very close to the creation of FENSA, which some of you who are not familiar with, it's a framework for of engagement with the non-state actors. This is it's a really good start that you have started talking to the insurance industry about what we can do collaboratively in this space. But perhaps let's be a bit provocative. Does the private health insurance or private insurance sector, is it represented in FENSA? And if so, why not? And why have we left it this far? And give us an insight into FENSA, because I'm sure many of our audience would be keen to hear about what it does or what it wants to do in the future. So Gaudens, let's start with you, and then we'll move on to other questions that come from the floor.
Thank you. And the framework of engagement with non-state actors was a 200 hours intergovernmental negotiation to replace or by an and. Some countries said we have to engage more with non-state actors, notably the private sector, but also civil society, philanthropic foundations and academic institutions. And others said we have to protect ourselves better from undue influence. So what was the reason for being the first UN agency with such complex and lengthy negotiation on that topic? It's the history of having been infiltrated and undermined, notably by the tobacco industry. And Ali, congratulations to AXA for disinvesting in tobacco. And I would urge all the others, it's not realistic to offer insurance products in the field of health and to invest the money that you make with insurance into tobacco. It simply doesn't work. So the reason for FENSA is to protect us from undue influence from tobacco or arms industry, also keep some distance where we are the regulators. In the insurance industry, and especially in the insurance industry outside the health insurance part, we are not your regulators, so we can work much, much closer together. And therefore, I would really encourage that we have to go into that. It's more a mindset which is now changing within WHO, that we realize, before we were looking at those who came immediately to us, pharma industry, food industry, where we are the regulators of them. Yes, we have to interact, but having the conflict of interest management. But to some extent, health insurance has a similar situation. But all the non-health part of insurance, we really can go into closer partnership and collaborations.
Video or your internet connection is rather weak. So in order to make sure that we have you for the length of the whole session, may we request that you perhaps switch your video off, so then your audio is stronger. If
on
that
my
is
side?
It.
Was that on my side?
Ali, can you hear me?
Oh, sorry, was that me? Okay, you were on mute. Okay, I'll put it off.
Okay, it's yeah, perfect. So hopefully we will have you here for longer without the risk of losing you altogether. Gaudens, thank you very much for that. We have somebody in our audience who would like to ask a question and raise their hands. I have Hani Saleh. Can we please unmute Hani Saleh? Hani, could you please introduce yourself, your organization, and the question, and please state who you are addressing this question to. It can be to both, or if you have a preference as to which of our panelists answer. So over to you, Hani.
Hello, everybody. This is Hani Saleh. I'm academic assistant professor in insurance and actuarial science. Actually, I would like to ask Dr. Ali about if he can give us more focus in terms of how to relate COVID-19 pandemic with the situation of health insurance in Egypt. And also, what about the degree of accuracy about the data of COVID-19 in Egypt in this term? Reliability about the real rate of mortality in Egypt, and how can work with the life expectancy for the community. Thank you very much.
Okay, can I talk? Hani, I think I got the first half of your question, but I must say we were having some difficulty hearing you clearly. So perhaps while Ali tries and addresses the first part of your question, you could type in a question in our chat box just to clarify what the second part of it. Ali, so I think the question as things stand is very specific to Egypt and health insurance in the context of COVID, and how you're really dealing with it with the integrated network that you have put together. So very briefly, if you could respond to Hani, and I know we have got a few other questions in case we lose Hani because of the bad connection for some reason.
Thank you, Adrita, and thank you, Mr. Saller. I hope you can hear me well. I'd really like to switch on my video. Let's try, because I could hear everybody really well. Let's go for it. If it breaks up, please let me know. I will try to answer your question to the best of my knowledge. Like Adrita introduced me, I'm actually a clinical doctor. I'm not an insurer. And what is important to highlight is that AXA One Health is actually a provider. So we are completely separate from the insurance side. And that's important to avoid any kind of conflict of interest when we are delivering the care to our clients, who are incidentally, we are open to both insured and non-insured clients. So we wholeheartedly accept out-of-pocket clients. So to the best of my knowledge, there were no outright products directed towards COVID-19 patients. Egypt was thankfully, or is so thankfully, one of the lesser hit countries, both on a health level and an economic level by the crisis and the pandemic. I can tell you what we did on the level of One Health. We created, alongside our response to our staff and for the AXA Egypt staff in our country, we created a care package that involved both physical and teleconsultation follow-ups for our clients. We facilitated testing when and as it became available, because at a certain point, if you are based in Egypt, you will know this, that the PCR testing was very highly regulated centrally, and it was not offered by the private sector or any kind of third parties. But as soon as that became available, we have started offering it as well. And we are working closely with the health insured clients of AXA Egypt to offer this when and where it is needed. The second part of your question, I think, regarded the numbers of cases and the morbidity and mortality related to Egypt. We are following the official statements sent out by the Ministry of Health of Egypt. And it seems we have successfully gone through the first wave. I can tell you, as a clinical practicing doctor, that a lot of the quarantine and dedicated hospitals for COVID-19 have been stepped down to back to their normal status. But that being said, we are still on high alert. We are very much aware that there is a second, and even within the United States, a third wave of COVID-19. Last wave, we lagged behind about 2 months. So we may still experience an unfortunate rise in the number of cases. And from what I have seen in the previous wave, that we seem to be well prepared. Certainly within One Health, we have taken all the measures possible to protect our staff, which was our real priority. Especially that, again, because we are a provider, our staff are on the front line. They deal with patients directly, and they must be protected. Thank you.
Thank you, Ali. We have more questions coming in, and let me just use this opportunity to reorder some of it, because Ali, you have given us quite a lot of insight on AXA One Health and the context of Egypt and COVID. We have 2 other questions, but I will start with the latest one. And perhaps I will start with Gaudens on this again, because of your level of exposure to the different kinds of pandemic that's happened in different parts of the world over the last 2 decades. So the question here has been, it has been difficult to get insurers to invest in pandemic prevention because many pandemics only has affected poorer nations in the last 2 decades. Do you think COVID-19 will change this? Do you think this pandemic will finally persuade the industry to understand the health and the financial effects of underinvestment, because it is now affecting developed nations, or perhaps one could even argue the nations where the insurance market is very, very mature? Do you think this is a turning point, Gaudens?
I definitely hope so. The pandemic as such was not a black swan event. We knew it was coming. What was the black swan is, on the one hand, the lack of international collaboration, and on the other hand, the underestimation of the connectiveness that the entire economy of the world depends on health. And people were not aware of that. I say I'm not convinced of it, but I hope so, and we have to invest into making people understand that, because the humanity has a tendency to put a taboo on such pandemics, be it the plague in Middle Age, be it the Spanish flu, the Hong Kong flu, which killed 2-3 million people in 1968, was simply ignored by society. So let's hope and let's work towards really changing that. And I know it's not just in our silos that we can do it. Therefore, I was asking to have us really work together, that your analytic capacity helps us make the case, which can help us convince government to set the incentive structure such that the market is there, that your products can really make a difference. So it's not, as long as we try to have that change simply in silos, it won't work. We have to work together on it.
Thank you, Gaudens, very much for that. Ali, very conscious that you are in Egypt, and you also may have a perspective, a view on this. So I wondered if you wanted to join in and answer from your standpoint.
Yes, no, absolutely. And I think One Health is an embodiment of what the insurance industry should be doing. When AXA decided to invest and to kickstart a project like this, it looked to emerging markets where there was indeed a need long before the pandemic hit, and exposed a lot of vulnerabilities on governmental levels in terms of preparedness, and all of the examples Dr. Silberschmidt highlighted. AXA is investing close to £1 trillion Egyptian pounds in this project, which is huge for the country. Again, within the public-private partnership realm, the government and the Ministry of Health are extremely supportive of this, and I think it has come in a very timely timing, where we were at the place at the right time. I'd like to highlight that One Health is very, very young. Like I said, we announced this project in July last year. You had asked me earlier, Adrita, about some lessons learned. We're a bit too young to have lessons learned yet, but I think we come in having done the right homework, having the right kind of attitude towards health and towards investing, and we're hoping that this will show an important return on investment.
Yeah, I think Gaudens wanted to come in and add to that. Please go ahead.
Yes, just to illustrate from a last answer and what Ali just mentioned, we really need to intensify that dialogue, including to speak on the same language. When Ali was referring to One Health, my understanding is really that the integration of primary prevention, secondary prevention, and primary health care and advanced clinical care, which I very much welcome as an integration. In WHO talk, when you speak of One Health, it's animal health and plant health and human health, and that interface where pandemics are born. So just to make all of us aware of that, even the same wording can mean totally different things. So that's only an invitation to have much more of such dialogues, because we can overcome those silos only when we get to know each other's world.
Absolutely.
Absolutely, and point very well made and point taken. And I say this from my own personal experience. I have a very mixed background. I have worked for public sector, I have worked for non-governmental organizations, and now I work for private sector and the industry. And I do find myself having to learn or relearn some of it, and in the end deciding that we just say the same things but mean with either using different words, or when we say use the same words, we mean different things. So absolutely, perhaps the collaboration, in the spirit of collaboration of what we have talked about, that could be a simple place to start as to how we define our problems. And on that note, let me move on to another question that has been submitted by, if you could please scroll. We're just trying to get the scroller up so we can look at the participant.
That's all.
No, can you? No,
I can see the question if needed.
I think there was a question that was put to us around data and creating data systems collaboratively, and it was a question addressed to both the panelists. So it's really asking, you know, what is the starting point, and how do you create data, trust around data and data systems that are much more human-centric? And the speaker, I think the question was put forward, and it's really asking both the panelists to elaborate about how do they see the collaboration of data that you have both alluded to between the insurance sector and a multilateral organization like the WHO. Perhaps you can start with that. We're having some difficulty seeing the full question here because other questions have come through, but hopefully, you know, this will try and address at least a part of it. So perhaps we'll start with Gaudens. Where is the collaboration? What does it look like when you talk about data analytics? How can we collaborate? And then we'll get the private sector perspective, and we'll also go to Ali to talk a little bit about, you know, what is the next step on that if we are to be seriously collaborating on it.
Thanks a lot. WHO is now 73 years in the business of data. On the one hand, we receive data notifications from member states. That means we have plenty of data, and I can give you one example. When you see now the COVID figures, whether you take them directly from WHO or you take them from Johns Hopkins or another source, 90% of the input is what member states notify to WHO, because we are the only universal organization. On the upstream side of data, it's also with the International Classification of Disease, the new ICD-11, that the norms of how you measure health data, how you measure disease, are coming from our WHO's norms and standards. So you have that part of data. At the same time, you in the insurance industry have plenty of other data looking at the same mountain from another perspective. And we haven't gone into, but I think there is a huge potential, of course, taking care of the data privacy. That's one of the private aspect. Of course, using the data in a human-centric, and Renaud is asking, for me, the human-centric way is, in our case, not for the individual, his data, but is for the good of the individuals, of the human population, and not just for scientific purpose or business purpose. But if we could tap and cross-fertilize the data oceans existing in WHO and those existing in the insurance industry, if we could get the best brains of both, analytic brains from both worlds, analyzing those data, we'll get much more insight and better policies coming out of them.
Thank you, Gaudens. Ali, from the private sector point of view, and anything Gaudens has said, do you want to react to that or add to that?
Yes, no, I mean, I completely agree with Dr. Silberschmidt, and I'm very pleased, obviously, that you mentioned the data privacy, which we take extremely, we put in extremely high regard. The shortcoming in emerging markets is actually being able to gather this data, and having worked in various hospitals, I have seen this firsthand. It's always incomplete and perhaps sometimes incorrect. And this is one of the strengths we have built into One Health. Like I mentioned, we have our electronic medical record that is linking all of our physical and digital centers together. We have built a digital hub to analyze this data because we want to extract meaningful insights from this to be able to share within, obviously, the data privacy constraints, to give us insight into both population health insights and trends, and also on a microscopic level, on a personal level, to give personalized healthcare with whatever information we're able to gather, including things like genomics and the results of specific blood tests, etc.
Thank you very much, Ali. We are nearly out of time, and I want to take this opportunity to go to both our panelists. You have about 30 seconds each. Give us your final remarks. We have made this breakthrough. We are finally talking, and we are talking to the World Health Organization. There are plenty of areas of collaboration. We have already signposted a few of them. So it would be really good to hear from you of something very action-oriented, what you want to take out of this, and where do you want to take this next? What are your lower-hanging fruits here? What would you like to collaborate on as a next step out of this conference? Gaudens.
So thanks a lot first. I hope we can take the dialogue further, but I would ask those on the call, let the Geneva Association, or through the Geneva Association, to us know where you have analytic capacity to help us digging deeper and making better the case of what Ronnie rightly asked, that we don't miss another crisis, the opportunity of really learning on how to start massive revolution in investment in prevention, preparedness, and health promotion. Thank you.
Ali.
I would say that everybody and know that we exist now. We are hopefully here to stay, and Egypt is just a pilot for this payer-to-partner and vertical integration. I must say here that we also have another, AXA has another pilot happening in Mexico, which is a joint venture with a healthcare provider there that pretty much offers the same ethos and strategy. We exist in INM in 32 countries, so we hopefully will be able to scale and multiply this this project, so that we can then really gather a huge amount of data to be able to help the population. Thank you.
Thank you very much to both our panelists for your time and for this very insightful and valuable contribution. We hope that we can keep talking. And with that, that brings us to the end of the session, and I will pass it on to Ronnie to do a quick wrap up of all the lessons we have learned so far before moving on to our final session, which involves two of the top CEOs from the industry. So Ronnie, over to you.
Thanks very much, Adrita. As you can see, we're trying to social distance here, and that's why we're standing so far apart. So we're trying to stay with the rules. Before we get to the break and then move into our highlighted session, which is the view from above, I'd like to go in reverse order and just summarize. So first thing I wanted to say, so thank you very much, Adrita, and thank you, Ali and Gaudens. Ali, this is the first time we've met, just not really even face to face, but I had Gaudens, he spoke about it. I had Gaudens at a conference in March. We had dinner together before that in early March. It seems like years ago, Gaudens, that we last saw each other. But Gaudens was in Las Vegas and was up on stage and said that I predict, this is maybe March 3rd or so, I predict that this city will be shut down in 3 weeks. And everybody in the audience laughed. There were 800 people and everybody was laughing.
The sound has gone, sorry. Hello?
Ronnie, we lost you. Everybody was laughing, but then we didn't hear anymore.
I remember there were 15 cases at that time. So I don't know what you saw, but you saw it. So thanks very much. It was great hearing from this team about prevention. We don't talk enough about prevention. I know a lot of companies are trying to work on it, but we really need to engage organizations like the World Health Organization to get involved. So I hope Ali and Garan will continue the discussion, and AXA and the World Health Organization will get together. Yesterday, if you were on the sessions yesterday, we ended with Steve Vernon and Dustin Yoder. It was a great discussion. I think Steve first talked about the elements of healthy aging, and Dustin talked about how technology can help with that. It was really, really interesting. And as you know, we will be sending the presentations via a recording of this to all of you, so you'll get to look at that, those who are attending. The first full session of the day, Richard Jackson, then we had Andrew Cairns and David Blake, had a great discussion setting the stage. Richard talked about these competing theories about whether people are living longer, or are they also going to be living healthier? And I think that's a really good discussion. Then David and Andrew got into this technical model about how COVID-19 is affecting people and their longevity. I know a lot of people look at, if you look at statistics and you hear on TV, everybody's talking about cases and COVID mortality. And I really think that you need to look at overall mortality, all-cause mortality. Because if you just look at the COVID mortality, it's very hard when you have comorbidities. It's very difficult to separate those out. So you have to look at that all-cause mortality, and that's exactly what their model did. It was quite interesting. Then, of course, before that, we had Janella Frias from Prudential, president of Prudential Retirement, give her views on everything that the industry is doing, and specifically what Prudential is doing in diversity and inclusion, not only in their own organization, which they're very, very interested in. And for the next session, we'll hear from both Rod Martin and Charlie Lowry about diversity and inclusion. That's one of the topics we're going to speak about. But Janelle gave just a great presentation on how education is so important and reaching them with the products that Prudential sells and the industry sells, but also what they're doing in the organization. So thank you for that. And then, of course, our own Jad Aris, Managing Director of the Geneva Association, kicked it off. And I think the main message I'll take away with that, which was just a great message, was that during the pandemic, the insurance industry, specifically the life insurance industry, has shown its resilience in this difficult time. And it shows that no time more that we need the insurance industry. So for all of you working for the insurance industry, thank you for what you do. It's very important, especially in this time. And again, thanks, Chad, for putting this together. Before we go to our break, we'll have a 10-minute break. Before we go to our break, please stick around. We're going to have our View from Above, where we hear from Rod Martin, the CEO of Voya, a very good friend of mine, and Charlie Lowry, the CEO of the hosting organization, Prudential Financial. And Charlie, I hope we become very good friends in the future. As Rod said on the phone call, it's difficult to turn me down. It's easier to just say yes. I hope you'll be one of those who says yes when you get invited again. So I look forward to our conversation. We'll have a 10-minute break, so everybody relax, get a cup of coffee, and we'll be back very shortly. I want to remind you of one last thing, and I'll remind you again when we come on. Is specifically for the last session, this is Chatham House rules. So please don't go around on your social media and say, Rod Martin said this and Charlie Lowry said this. Just the messages that come across, you know what Chatham House rules are, so please bear with us on that. So thank you very much, and we'll go to our break. Hi, everybody. Welcome back to the Geneva Association Health and Aging Conference 2020. I think we're all excited to hear from the next two speakers, our View from Above, with the CEO of Voya Financial, Rod Martin, I will tell you, if you've not heard of the name Voya Financial, if you're international, it is the old ING US insurance business. Rod was handpicked and stolen from AIG to come over and take that company public, which he did in 2013 very successfully. We're going to talk more about that. And prior to that, at AIG, he was the head of all life insurance at AIG. And if you know, that's quite an international job with all the insurance companies we had. It's a little tough, Rod, to see all those companies now owned by different organizations, but they were all, one time, they were all at AIG and under Rod's control. And of course, our hosting company, Charlie Lowry, Prudential Financial. Prudential is a name everybody knows. I think you stole the name. Did I read, Charlie, that you actually stole the name from the UK company that John Dryden brought the name with him because he visited the UK? You'll have to tell us a little about that before you start. So Prudential Financial, just an absolute great company. And if you've ever been to Newark, that's all you see is the Prudential name. So thank you very much for being here, both of you. I will tell you that we, you know, the crowd knows this, right? We put together a bunch of questions. They get to look at them and prepare for them. So these are the questions, but we're not going to ask these questions. We're going to go with a whole bunch of different questions that I have. So it's all up for grabs right away. But Rod, let me start with you. Voya, it's only been around with that name. I think you came up with the name personally, right? You didn't even have a team to do that. Voya, you started with the company with ING in 2011. I think the IPO was 2013, if I'm remembering correctly. And you've made a transformation. I mean, it's a low interest rate environment, and you had this dream to turn this company into a retirement company. With these low interest rates, still since the financial crisis in 2008, which we know very well from AIG, but from the financial crisis, and now through the pandemic, the interest rates have been so low. Was this really the right decision? Talk us through that. Is it sustainable to sell annuities? How annuity sales been? What have you done to Voya to change the company?
Ronnie, good morning. And Charlie, it's wonderful to be with you, even virtually on this program. And Ronnie, you've summarized kind of the journey that we've been on. From ING US, we inherited an array of businesses, their then US businesses. So it was a retirement platform, an investment management employee benefit platform, but it also had a fixed and variable annuity platform and a large life insurance platform. And Ronnie, you correctly state, we went public in 2013. And we really have been on this kind of from-to journey, from what we inherited to what we aspired to become, which is fundamentally a workplace and financial institution-focused company. And it's been a 7-year journey in choosing to lean into the businesses that we think are the growth businesses prospectively in the US, and frankly, properly exit from businesses that were either highly interest rate dependent or capital dependent or both. And again, these stories and executions of these kinds of strategies don't happen overnight, but we did sell our variable and fixed annuity business to Apollo and Athene in 2017, and we're closing in the fourth quarter of this year our life insurance business. And that's not to say that either the individual annuity or variable annuity businesses or individual life aren't good businesses. They are highly capital intensive. They're particularly challenged in a lower for longer interest rate environment. And we simply chose to be more workplace focused for the employer and the employee, and institutional focused. And so it's been a journey that we've been on. Certainly the environment that we're in, let alone the environment that we started in 2008 when I got there, or not 2008, but 2011 when I arrived, in 2013 when we went public. It's been the right decision for Voya. And so we are far less interest rate and equity market dependent than we were before. And obviously it's been challenged, Ronnie, by the COVID environment, but we're fundamentally today a B2B type of company. And it's served us well. And I think you see that reflected in our growth. I think you see it reflected in our valuation. And ultimately in our free cash flow conversion, that the story that we talk to investors about, and in our case, it's about 85 to 95%. Back to you.
And the investors that you're talking to, are they coming along with you on the journey? I see the stock price is obviously doing well. So how are the investors reacting to this strategy?
They have, and again, that's a slow and steady process always. But I think they understand the challenges of the interest rate environment. And again, that isn't to say companies that are choosing to be in those businesses have made bad choices. It was a capital allocation question for us. So we felt we could allocate our capital for both higher ROE and less capital dependency on those kinds of things, and have a high free cash flow conversion, and ultimately hope to have that reflected in our valuation. And over the 7-year period of time, I think that's proven to be an accurate conclusion for Voya. So the marketplace, our investors have responded well to that, and really we're completing that transformation piece with the sale of the life business in the fourth quarter for us. Now, that's not to say there's not a need for life insurance in the U.S. There's a significant need. COVID underscores that. We're providing that solution through our wellness program and frankly through our employee benefit offerings. So we offer both voluntary benefits, life insurance solutions, as well as group life solutions. But the investors have really been supportive, and I think again that's reflected in the valuation and the stock price.
Thanks, Rod. That's great information. I will tell you, a bunch of people liked what you were saying because we had 4 more people join the conference right during your discussion. So thanks. Charlie, Prudential's a little bit different story. I mean, Voya, even though it was ING US, Voya with the name branding and everything, it's only been around for seven or so years, and Rod comes in and it's a little easier to change course. Prudential's been around since the 1880s or so. So it's a little more difficult, I think, for you to change course. But you've announced that you're divesting from some of the interest, dependent on returns products. That's been public. I'm not giving any inside information. Can you take us on that journey as to how the market has reacted? Can Prudential be as successful as it's been over the course of 150 years? What's going on with Prudential's strategy and the investors as well?
Sure. So let me just start by saying, Rod, thank you for joining us today. This is fantastic. I am a huge fan of both Rod personally and what he's doing with Voya. The transformation has been miraculous, and he's a role model for all of us.
Thank you, Charlie.
Just to set the record straight, though, John Dryden did not steal the name Prudential. He actually was working for Prudential UK and went to the chairman and said, may I take the name and the strategy at the time and go to the US and start something, which was insurance for the working class. At the time, we couldn't afford insurance. And the head of the Pru UK said, of course, we're never going to go over to the US. And 150 years later, we find ourselves competing around the world. But that's the story. So just want to set the record straight there for me. So to get to your point, I think the value of our products, and our products, you could include Voya's products, you could include Prudential's products, really the industry's products. And what we do is even more apparent and more important to people in this volatile and low interest rate environment in which we find ourselves today. But for us, in particular, because we are in the life insurance business, we are in the annuities business, low interest rates and a lower for longer environment is absolutely a headwind. And we've had to implement pricing and product actions to simplify and de-risk our business mix, while at the same time protecting our profitability. But we also have to we have to think about our customer and protect customer value. And in this environment, some products just don't make sense from a customer point of view. And so we stopped selling them. For example, we took aggressive pricing actions and essentially eliminated our legacy flagship variable annuity products. And in their place, we launched FlexGuard in May of this year, which was our buffered annuity product. And we did a similar thing in our life business, where we just shut down parts of the business because it just didn't make sense. So in a nutshell, we're looking to do more on a long-term basis and transform the company in some ways the way Rod has done with Voya to a less market rate sensitive company, a less interest rate sensitive company, a less capital intensive company, and a company with higher growth. And we've stated that in the past in terms of our intentions as we go along this journey. And we hope that with our diversified business mix, we can continue to serve the needs of our customers, but do so in a way that has more predictability of financial results, which we hope will have a direct impact on our multiple and valuation over time. So it's a journey that we're going through, as Rod has taken Voya through, and we're just in the beginning parts of that journey.
So thanks, Charlie. One of the things that always bothered me about retirement annuities, and by the way, both Rod and Charlie, I have lots of friends that always come to me and ask me questions about, oh, I have a chance to take the lump sum, or should I take the retirement annuity? And it's, you know, one of those quick, easy answers, but then you look at the numbers and try to explain. And even my friends, even the ones who are not as good with numbers, will say things like, oh, I have to live to this age to get my return on investment if I buy the annuity. I'm one who always said that, you know, an annuity, a retirement annuity, is insurance against outliving your income, outliving your assets. That's what, you know, an annuity is. However, the salespeople do sell it as an investment. In low interest rates, it's very easy to see through the age. If there's a 5% interest rate that you're earning on that, it's much more difficult for the average person to see through the age. So how do you get that? Is that a message you're trying to get through to Prudential, that this is insurance against outliving your assets as opposed to an investment? How do you get that message across?
Well, I think there are a couple of things. One, it depends on the product, right? Because there's some where you can get a return of principal. So it can be an investment of sorts, as well as protection for longevity. So I think it depends on the product you buy. But there are different products for different people to serve different needs. But in general, people buy annuities, I think, for protection against longevity, which has become more and more of an issue over time.
Okay, thanks very much. So that was our low interest rate section. Let's move to something I think a little more near and dear to both of your hearts, and that's diversity and inclusion. Again, you heard Charlie earlier that Janella was on yesterday and did just a passionate presentation on this and how much Prudential's involved. And I know that you've made, I think it's a $10 million investment, something called the Financial Solutions Lab or something like that, on closing the racial wealth gap. Can you explain a little bit about that and some of the programs that you're working on at Prudential?
Sure, and this is a subject about which Rod and I are absolutely passionate. So delighted that we can both have a chance to talk to you about it. You know, so our commitment to supporting racial equity is long-standing, and this is an issue. We feel so passionately about this because this is an issue that is aligned to our purpose, and it's part of the fabric of the culture and critical to the success of our organization. And we did recently announce commitments to advance racial equity and announce them publicly, which is different than we've done before. And this contributes and aligns with this investment. So a small part of supporting racial equity means designing products and services to improve outcomes for people of color and underserved communities, many of whom have been disproportionately affected by the pandemic. And the contribution we made to the Financial Solutions Lab is part of that commitment. The Financial Solutions Lab, just to go back, was created in 2014, and it's managed by the nonprofit Financial Health Network. And the lab's been really successful in working with fintech companies to develop and scale innovative products and solutions that support not only people of color, but tens of millions of low to moderate income individuals. And our partnership with the lab will allow it to get capital into the hands of startups to help fund and scale solutions for this broad and this really diverse population. As a financial services organization, we have the responsibility, as I think we all do, to build solutions that serve all Americans. So this is just one facet of that aspect.
Thanks very much. Great information. And again, thank you to Prudential for everything you're doing on this cause. I know as someone who puts together a lot of conferences, and Rod, you know that because I always ask you to speak at the conferences, but as someone who puts together a lot of conferences, it's very difficult to find women and people of color in senior positions at insurance companies who are willing to speak. So one, it's difficult to find people, and then it's difficult to find people who will speak. So hopefully your efforts at Prudential will make this easier, as time goes on. Now, Rod, we've worked together. So again, I think the audience well knows that now we know each other, and I know your personal commitment. So I can close my ears on the next part, but please tell everybody else, what Voya is doing in this field of diversity and inclusion, and you can add some of the things that you've done at AIG as well.
Look, Ronnie, as Charlie has just spoken, this is one of the many things that we have very, very similar views on, and they're doing some incredible things, and we're trying to do our part. Look, at Voya, we started, Ronnie, with a fresh piece of paper 7 years ago as a new public company, and in some ways that may be a bit easier. But when you and I were together at AIG, this is a topic that has been, for those that know you, and most do, long passionate for you, and it was something that you helped shape and form with me and our team at AIG, and really we brought that thinking to Voya. So it's been foundational, and one of the ways that I felt we could make the strongest statement the quickest, as ING Group sold down their interest, we were able to obviously appoint an independent board, and we got to parity on our board in about 2 years and in 3 months. And today, as we sit here, by way of example, 4 of the 5 board committees of our board are chaired by women. There are 4 women on our board. There are 4 men on our board. We're about to add another. So, 5 of our 9 independent board members are minorities or women. And it's been able to make a statement that this is something that is really important to us. It helped become kind of a foundational element as we began to push, shape, and form the culture we wanted to build at Voya. We had the good fortune of inheriting some great legacy companies, some terrific employees, but we had a chance to put our finger on what did we want that to look like, and what does good look like. And we've been included, as Charlie has. I mean, these are things that are quite similar with our companies, but on Bloomberg's Gender Equality Index. We've been recognized by Ethisphere as an example as one of the world's most ethical companies. Every year we've been eligible for 7 years. We've been, we just continue to make this a priority. And when you start with the board, again, we had the opportunity 7 years ago to start with a fresh piece of paper. That began to cascade down in the organization, Ronnie, and it doesn't, again, happen overnight. But, when I got there, the senior team that I inherited looked an awful lot like me. Today, it is majority women and minorities. It's just changed over time. Half of our businesses are being led by women today. That wasn't the case when we got there. And we're not just doing this because it's the right thing to do. These are the people that are of the talent that's in the organization. It's about unleashing that, identifying them, and putting them in leadership roles, and then standing out of the way and letting them go. But I can tell you that it's helped form and shape our board. It's helped change the conversation in the boardroom, and it's helped cascade this in the organization that it was important. We were serious about it, and it's really made a difference. And again, the great work that Charlie and Prudential, Charlie's doing and Prudential has done for a long period of time is a wonderful example, but equally important here. And it's something that he and I have been very vocal about on programs like this, and I think we need to be. And we're in many of the same conversations, and frankly, participating in many of the same organizations that support this initiative and shine a light on it.
Thanks, Rod. Thanks for your passion, both of you. I found that you agree on so many things. I'm trying to find the things that you don't agree on so we can get a little discussion going here. But I will tell you, as the parent of 4 children, and some going into the workforce, some in the workforce, some going into the workforce, the younger kids today do look at the companies that they want to work for, and do look at the boardroom on the website, and say, is this a company that I think I can succeed at? Is this a company that I want to work for, that I'll be proud to work for? So I think it is very important for a whole host of reasons, but also for attracting talent as well. And I know you both know that, but I just wanted to state that. So again, thank you for this. It's very important. Rod, you were going to say something.
Well, I was just going to pick up on a point you made, and again, this is not scientific, but I have found that for those of us that have daughters that are of that age, Ronnie, they do pay attention to that, and I've got a 35-year-old daughter that pays a lot of attention to that, and part of that is, what's the kind of environment, Ronnie, that you want your children, the company that they want to be associated with, and I think no differently than that, and I know Charlie well enough to know that he doesn't either. So it does impact and influence this, and I think it's one of the things that we can do to set a stage that's different prospectively. And I'm very proud of the fact of what we're doing, what they're doing, and what many are doing. It's long overdue. When people say there's not enough qualified candidates out there, candidly, that's just baloney. You need to open your aperture in your thinking. It's not a supply problem, it's a demand issue. And when you've got a leader like Charlie, or in our case, Voya, that's saying, no, this is important and we're going to make a difference, differences are made.
Charlie, it looked like you wanted to add something as well.
Yeah, just to pick up on what Rod said, people, we're recruiting now in this virtual environment, but people really do look at your board, and they look at your purpose. And after some of the folks who have, and these are senior people who we've hired, have come in, I've talked to them and said, why did you come to Prudential? And they say, we looked at your board. In our case, our board is 80% diverse. And they said, but as importantly, it's your purpose. It's what you do. So what we were talking about before, about our commitments to our employees, our communities, all the stakeholders, it's really, really important. And more, to Rod's point, people are looking at both inclusion and diversity and what you're doing there, as well as the purpose. What's the purpose of the company? And do you have a larger purpose than just making money? And that's becoming more and more important.
Yeah, we're going to get to that also with the environment, and I do want to talk about the boardroom and the investors and how you balance these things, and we will get to that. I want to switch over. I mean, it's on everybody's mind. By the way, I was going to start the conversation. I was going to start the conversation with saying that it's a debate and you only have 2 minutes and I can mute your microphones, but I thought the international crowd wouldn't really understand what's going on there. But anyway, so let's move on to COVID-19. We all had to relive. I was just coming in to Zurich on the train. So I'm here at the Geneva Association offices. I don't have one of these signs in the back here at home. So I'm at the Geneva Association offices. I come in on the train. I put a tie on. Sorry, guys. I told you I wouldn't wear a tie, but I hadn't worn one since our dinner, Rod, in Las Vegas. And I'm looking around and seeing people with masks, and it's just surreal. To walk around the entire train platform, everybody's wearing a mask, just going about their business as if, it's normal, how some of us adapt, how some of us don't adapt, but the whole world has changed with COVID-19. The one thing is, we always hear in the life insurance industry that insurance is sold, it's not bought. We hear that. I hate that expression, but I've heard it for the 40 years I've been in the business. So, Rod, if maybe I'm wrong with this, but you started out selling insurance. You're an agent. You know this better than anybody. So, Can you tell us how the agents are adapting to this? Suddenly, they're not this face-to-face meetings at the kitchen tables, or even the worksite marketing that your company is doing. They're not there at the worksite marketing. So can you tell us a little bit about how that is working out for the agents and how they've adapted? And to continue on, do you think it'll ever go back to the old normal?
Sure, Ronnie. And you're right. I mean, we attended a dinner in late February or early March, Ronnie, together, and it does seem like a lifetime ago, and yet it's 6 or 7 months ago. And 15 days later, we were all working remotely. And Charlie and I have talked frequently during that period of time because of all the innovative things they're doing, and are trying to just share ideas and practices as we go through this unprecedented period of time. But we were able to move fully remotely. Companies invest a lot of time and energy in those contingency plans. This is one of the first times we've really ever fully, all of us, had to stress test that outcome. And fortunately, I think for both of our companies, it has worked really well, not without any hiccups, but worked really well. So we've been working remotely through that period. And Ronnie, obviously everyone has had to adjust. In terms of our distribution platform, as we talked about, we're fundamentally a B2B business, but that doesn't change. That still has to be done remotely. So the amount of Zoom meetings and calls and all the other innovative things to both develop, maintain, support, close, and open new business has had to change. And I think you'll hear from both of us that it's been a rather remarkable journey. Many of us came off among our best years in 2018 with great momentum going into 2019 when this emerged. And I'm pleased to share with you that the companies, and I think you're going to hear this from many, have found themselves to be pretty resilient. It was obviously, it took a little while, but we have found a way with our customers to both develop, open, and close business and maintain those cases through this period of time virtually. And the premium that we've both put on the safety and security of all of our stakeholders, our employees, our consultants, our advisors, the TPAs that we do business with, the customers. I mean, they're equally concerned. And Ronnie, I know that you've got a broad view of the world, but this is unfortunately not going away very quickly. It's not great in the US, but it's reemerging, as you well know, in Europe in a way that we're going to be in this circumstance a while. So we went virtual mid-March. We had the last public announcement we made in terms of our reopening in the US will be at the beginning of the year at the earliest. And based on what I see now, that's likely to be extended. And so we've had to find ways to continue to operate and open and close business. And again, part of what we've said to all of our stakeholders is we came off, in our case, the best year ever in 2008. In 2019, we're not at 2019 levels, but we are at about 2018 levels in terms of results. And that was one of our better years. So we've found a way to do it. It hasn't been easy. I think, Ronnie, it has been and will be a permanent shift. I think we're going to find that, our company, in our case of our 6,000 employees domestically, 20% were virtual before COVID ever happened. We've been doing that for a very long period of time, the entire time we've been a public company. And I think that 20% is likely to go to 30 or 40. I think you're going to see a hybrid model emerge where we'll have people in the office on some periodic basis. And there's a group that wants to come back, and we can't wait to welcome them back to the office when we think the science supports that. So I think we have to find ways, and we are working on finding ways to continue to open and develop relationships, close business, maintain customers and clients and cases in this environment. And we're doing it, and we're learning from others. And I think it's the world has changed, and I don't think it's ever going to go back fully to where it was. Back to you.
Thanks very much, Rod. Very, very, very insightful. I will tell you, yes, Europe, we are experiencing a surge as well. I just read 17,000 new cases in Switzerland, our small country here, our landlocked country here. Now, it's easy from the US to look at Europe and say, oh, there they go, that's really bad. We started from a low point, and I just hope that the second surge doesn't hit the US as hard, but I fear it will. So yes, I agree with you. We'll be here for a while. Charlie, I can ask the same question, but I was hoping to get a more of a employee perspective instead of the sales force, but you can answer both as well. And especially that Prudential does invest a lot in real estate. You have 213 Washington, I think, still, if I recall back from the day. You have the big Prudential building. You're all over Newark there, downtown Newark. Is that still a great investment? Do you think you're going to fill those seats, ever go back to the way it was again? Or are people liking this? Just before you answer, I will tell you on CNN, just recently I heard Mario Greco from Zurich Insurance Group, another member, getting on and saying, we're not traveling for the rest of the year. We probably won't do it next year either. It's better on my employees' bodies. It's better on the environment. We're starting to realize that we can get along without doing it. Is that sort of the philosophy, or do you think it will get back in a year or two to the way it was?
Yeah, I mean, I disagree 100% with Rod. Just kidding. Just kidding. Just trying to, Ronnie saw that. Unfortunately for you, I agree completely with Rod. We aren't going to go back to the way we were. Interestingly, what we've found is that our employees, only 70% were in the office on any given day. As Rod said, there were probably 20% working from home. There are 10% that are traveling or on vacation. So the occupancy, if you will, was only 70% to begin with. And if you think we're going to go to a much more hybrid environment, you're probably down to about 50% occupancy anyway. And so that's going to affect the footprint. How it affects the footprint and where it affects the footprint of what you own is going to be determined by one's philosophy about the hybrid approach you'll take. And I'll come back to that in a minute, but we made an announcement last week that no one essentially, except a few essential workers, are coming back until July of 2021.
Wow.
So again, with Rod's point, he and I have chatted about this before. We were completely aligned through the end of the year, and there isn't going to be a vaccine. There isn't going to be a panacea. Cases are rising. So we just said, in order for employees to be able to plan through the school year, we'll say it's going to be July, and then we'll reevaluate then as to what happens. So, but employees have been amazing, right? We transitioned over 95% of our US employees and most of our international employees to remote work in March, and continue to work with a few hiccups given the rise in calls to some of our customer centers, really, really well. And we continue to work that way. What I worry about, and what I think a hybrid model begins to solve, are three things. I worry about innovation. So where the constructive collisions of, say, Rod and me after a meeting, gathering around the water cooler saying, what do you think about that? Just sort of spontaneous ideas. I worry about that. I worry about how younger employees learn and progress, because younger employees learn a lot through osmosis, through watching their more experienced colleagues handle situations. Hard to do in Zoom, right? And hard to meet a lot of people so that they can progress up in the organization. So we worry about that. And the third thing we worry about is how to protect and nurture the culture. Because again, culture is amorphous. You experience in the hallways, you kind of learn about it. In various ways, watching people do the right thing, and all the parts of the culture that we're proud about. And so I worry about, with hiring a vast number of people remotely, which is what we have to do now, how do they understand the culture? So you need interaction for these. So what we're thinking about is the future of the workplace will be a combination of working from home and then coming into the workplace for creativity and mentorship and other things. It's not just going to be, okay, Rod, you work from home, and Charlie, you work in the office. It's going to be a combination of each of us coming into work for a few days, and kind of timing that as to our needs, our the requirements for innovation, getting together to brainstorm for a day or so, and then going back out. So it's going to be a hybrid model, and that will take less real estate space as we go forward. It will take more collaboration space. So we have to think about the composition of that space, and there'll be a lot of hot seating, but it'll be less space.
Yeah, thanks. One of the things that I think about is, yes, Charlie, it's true that you don't get that culture, but one of the great things about this technology now is that people will have more access to you. You can have more Zoom calls with larger crowds where people might not have had this access with you. So for example, even this conference, people can, your employees can Zoom in and see your culture right there from the top and feel your passion. Rod, we've had these discussions in the halls at AIG many times where I walk by and say, you know, we're in the financial crisis, Rod. You know, I need this vision. I need a picture to shoot for. I'm so disappointed. I think we told the story on our prep call, is that my wife would walk in the streets with her AIG backpack and people would scream at her. And you said, Ronnie, relax, this will pass. And those comforting words from the CEO or the head of the life division, so let's say my CEO at the time, the comforting words really does help the employee, you know, that's non-panic and a plan. So I think better access to you. So I'm not giving advice, Charlie, but let them have access to you, because there's no better spokesman for Prudential than you and the culture. You've gone through the culture, you've been there a while. So I think that's great.
Well, one of the things, Ronnie, we've talked about, and Ron and I have talked about this, we can't communicate too much. So we do videos, weekly videos or bi-weekly videos. I've started to actually Zoom bomb into meetings, which is actually quite interesting, where you tell the head of, let's say there's the head of a division is having a meeting with their directs, and you say to him or her, can I come in for 10 minutes? No one else knows. So you just kind of come in for 10 minutes, you chat, and then you let them get on with their business. But to your point, we have to find creative ways of essentially walking the halls and doing that virtually.
So the undercover boss is walking around. Yes, I understand.
Virtually.
Okay, let's move on to the environment. Another topic, unfortunately, you're both going to agree on, I think. But let's talk about the environment. And this is one where I think we bring in the boardroom, you have your policyholders, you have your shareholders, and of course you have your employees. And I'm wondering how you walk that tightrope with the environment. Charlie, you've announced some, what I think are some pretty expensive initiatives to help with the environment. How do you bring your investors along? So first talk about the initiatives, and then how do you bring your investors along, your shareholders along, that sit there and say, wait a second, that's my money that they're using. Why are they using my money to do that I might not agree with? So how do you balance those things? It's got to be quite difficult.
Yes and no. I mean, we need to do it, and more investors are looking to see what you do in this space. And so there is a balance between doing everything you want and providing value to all stakeholders. But I don't think they're mutually exclusive in any way. And for instance, we've established several goals to achieve over the next few years, and in terms of environmental reporting, educating and engaging our employees, resiliency preparation, all sorts of things in order to promote what we're doing. But our commitment, I think, to shareholders, customers, and employees goes hand in hand with our responsibility of the environment, ensuring it is protected for future generations, because that's good for our business. So I don't think they're mutually exclusive. And in fact, more than that, investors are looking very specifically to see what we're doing in this area and if we're doing enough.
And Rod, I know that Voya has some environmental commitments as well. So pretty much the same question. How do you make that balance? Are you finding the same thing as Charlie, that the investors are coming along, or at least the ones maybe that you want to come along?
Ronnie, this is something that the orientation of this was actually one of the great legacy pieces that we inherited from ING Group. And for all of your non-US colleagues that are participating in this, certainly you're well aware that Europe and other parts of Asia have been more dialed into this and more oriented to this than the US has historically. But it is very much becoming a very important part of many US companies. Certainly I know Charlie and Prudential are doing a great job in leading this, and it is with us too. And part of it is, again, the commitment you make and the consistency of the story you're telling. But I can tell you from both a customer perspective and institutional investor perspective, and the reception of that increasingly from the investor reaction. We've been talking about this for some period of time. We've been fortunate enough to make some really good progress on this, and and this is another example, a little bit like the diversity and inclusion piece, Ronnie. It needs to be authentic. You can't just say the words. You need to be able to demonstrate the actions. There's lots of organizations that measure the effectiveness and the output of this. The bar keeps continuing to be raised, over time, and we've had the good fortune being recognized by Barron's as one of the most sustainable companies in the U.S. and for the last 2 years, it was the highest ranked financial services company, and that for a certain set of investors is quite important, and they're screening for that. And again, I think it's just the consistency of and the authenticity of where you're going. And I'll drive it back to a point that Charlie made, which is really it ties back to purpose, not only their purpose, but our purpose on, if this is important to you, it's one of your core values, it will attract employees, it will attract distributors, it will attract investors over time. And that's certainly been our experience. I think we're going to see this dramatically increase over a period of time. It does require a significant investment of time and attention and measurement. And the most important thing, like all of the themes that we're talking about, authenticity.
That's great, Rod. Charlie, I just want to go back to you on sort of what Rod was saying. Do you have these values? Are they something that people carry around with them? I know, Rod, when we were at AIG, when Martin took over, there was these 5 or 4 or 5. I think I still have that little plaque or something with the 4 or 5 goals. And sorry, Charlie, this might not be as funny to you, but someone asked a question when Martin was giving a presentation. Martin Sullivan was giving a presentation on this and said, if someone doesn't meet one of these goals, what will be your reaction, even if the person is a really good employee, but they're not meeting one of these goals? And his reaction was, well, and then you could have thrown the thing out right then and there. It's like, do you have these goals so that people know about them? And will you take action on these goals if someone's not meeting them?
Absolutely. Our first goal is to do the right thing, right? And if someone doesn't do the right thing, you fire them. I mean, it's that simple. And so there are some sort of lines which, if you cross, that's it. That's table stakes. One of the others is to make and keep long-term promises, right? We're in the business of long-term promises, so we have to create a sustainable company. We have to think about the strength of the company and the resilience of the company to fulfill promises that can be upwards of a century long, if you will. We still have a group annuity contract from 1928 that's outstanding. There's somebody that I think it's one person at this point, but we keep paying it out. So it's phenomenal. And when you think about the long-term nature, so yes is the answer. There's certain lines in the sand, and if you cross them, you will not work for Prudential.
And Ronnie, just to reinforce that again,
Dean, I'd like to know
comes
that
back-
person. They're probably going to inherit a lot of money, all the dividends and everything like that. So, Rod, it looked like you might want to add something.
Yeah, I was just going to reinforce. Look, this gets again back to the transparency and the authenticity of this, and we measure something that we call the what and the how. The what is what what the outcome, what a group or an individual contributed, and the how part is it consistent with, again, your values, and that's very self-evident in any organization, and honestly, companies that are making the kind of commitments that Prudential and Charlie has made to this and Voya has made, I mean, that's part of what these organizations are looking for is not only are you saying these are important, are you measuring it, and are you acting in that way? And I think it's relatively easy when you're as committed as we both are to this, because organizations become quite self-correcting in this outcome. It will attract people that are committed to this, and I think those that are less committed might find a more comfortable home somewhere else.
And
I love to hear your passion. By the way, this is exactly the culture that's being passed down to your employees now, especially those that are on the line. So, and I know we have a number of people who are probably filling out their forms to apply to your companies right now. So thank you for your passion on that. Let me just now move to insurance of the future, which is actually a topic very close to my heart. I've done a lot of research on this, and I've been in the insurance business also, Rod, maybe not as long as you, but just a couple of years less than you. And it's just painful to see insurance sales in all markets, all mature markets, but you're both in the US, so let's talk about the US. The US insurance sales have been flat, if not declining, since the 2000s. So it's not the financial crisis, it's not bubbles, it's not low interest rates, it's insurance sales have been flat. Rod, I'll start with you because you're sort of divesting of life insurance. So you have a view maybe outside the scope of your company now. So it's actually a great question to ask you. Why have they been flat? What is the insurance industry doing wrong not to expand these sales? Now, and just don't get me wrong, we still have, trillions, maybe I think it's estimated over 30 trillion of assets in the insurance, both life and non-life market. So it's a very, very important industry. We all know that very well. But life insurance sales have been flat. How do we grow it and attract that new market?
And Ronnie, I think you're also referring to fundamentally individual life sales. And look, there's lots of alternative distribution platforms that have emerged and will continue to emerge. We're continue to provide life insurance protection and protection elements through both our group and our voluntary products. Charlie's done a very interesting acquisition in providing another methodology to acquire insurance that I'm sure he can speak to. But part of it is companies increasingly, in my mind, no matter how large they are, have to decide where they're going to allocate their capital and focus their energy and their talent. We've chosen the workplace and financial institutions, which is fundamentally B2B. That isn't to say the sale of individual life is a bad business or individual annuities. We've chosen to leave the retail products for the workplace and the financial institution focus. So we made that decision for a variety of reasons. The capital we had was the capital we had when we created the company. And my view of the market and the interest rate environment was such that I think it's proven to be, for us, a good decision. But Ronnie, I think there's a lot of mediums that are going to emerge in allowing people and enabling people to buy either individual life products or voluntary life products or group products as we go forward. And I think increasingly employees are looking to their employer for those kinds of solutions. So it's a fundamental decision we've made for the reasons that I've outlined. The product is critically important. There's a need. Actually, a pandemic is a period of time where I think people reflect on that, not just because of all the tragic people, the tragic issues of people that are being lost, but I think people are focusing on what their wellness plan is, what their family plan is, and are they appropriately protected?
Quite interesting. So I totally agree with you, and I think what I hear you saying. So I'll let you correct me on this. Is that perhaps people have more faith or trust their employers more than they do maybe an insurance company, a financial institution, even though the employer might be using the financial institution to sell the insurance, but maybe the advice or something like that. Is that maybe what you're finding? Is that it's a trust issue?
Look, I think increasingly employees, particularly I'm talking about a U.S. perspective, and this is my view, employees are looking to their employer, all industries, increasingly for wellness solutions, and that's both an array of products, traditional products that we'd be familiar with, and in other products. I mean, COVID, for example, health and wellness, mental wellness. I mean, increasingly they're looking to their companies for providing access to an array of solutions, and that's what we've been focused on. Is certainly, and I won't speak for Charlie, but what Charlie has been focused on, and we're all going to figure out a path to get there. But I think that is a way largely that's been done. Not that there won't be sales of individual life products from companies that offer those products. I think it's just very challenging, and particularly challenging in a pandemic when you're having to do this face to face on a retail basis.
All right, Charlie, I'll let you to respond to that as well, but I did want to change it a little bit and talk somewhat about financial literacy. Again, something you and I probably have very much in common, and Prudential in general. I'm a big fan of financial literacy and think that it's very important to educate our youth from a very early age. I always tell the story, Charlie, you might like this. When we moved to Switzerland about 10 years ago, my youngest was at that time, I think 6 years old, and she comes back from her school, and 6 or 7 years old, she comes back from school and she says, "Hey, Daddy, today we went into the woods, the forest, and we learned to use a Swiss Army knife." And I'm American, my daughter's using a Swiss Army knife. I look at my wife who's Swiss, and she says, "Oh yeah, I bought her a knife, to go on this trip." Of course, it's a plastic blade, but it's still extremely sharp. And she's talking about learning to survive in the woods and all that. And I'm sitting there and saying, it's important to learn how to use a Swiss Army knife. That's really important. But wouldn't it also be great if we learned about financial literacy and how interest rates work and compounding of interest, even though they're low interest rates now, and saving for the future and all that. So what is Prudential doing in that area? And what could the industry do better to educate people on financial literacy, which will help them make better decisions and maybe buy more of our products?
Sure. So let me just start with piling on to what Rod said, and then I'll come back to financial literacy. But we couldn't agree more that more and more people are trusting their workplace, and that it is absolutely a wonderful way to help people not only with products but with education as well. And Ronnie, that gets to one of the points about financial literacy. We have programs, as Voya, to help educate the workforce, our workforce clients, about financial literacy. That's everything from balancing a checkbook to the importance, as you said, of compounding interest, to thinking about emergency savings account. 60% of the country can't afford a $400 emergency payment. To student loan repayments, how do you think about that? So financial education within the workplace is fundamentally important. It's an easy venue to get to, as opposed to sort of mass retail, but that's a starting point. In terms of the question on the individual side, customers are used to the Amazon environment. They want things when, where, and how they can have it. But if you think about expanding the addressable universe, you have to think about a different distribution, a lower cost distribution, and simplified products. Because right now the distribution system is high cost, which means you're going to have complicated products selling to a higher socioeconomic level because they're the ones that can afford it. And so how do we transform that with both education and with access to have folks have lower cost distribution? And that's going to be digital, it's going to be hybrid, there are going to be lots of different models that are going to be created in order to provide both education and then product that is understandable and affordable. So we're doing a lot on financial education. We spend a tremendous amount of time now. We have everything from programs in Newark called Learn, Do, Earn, where we bring in high school students to, and even grammar school students to learn about compounding of interest, to say you have to learn and then you have to do in order to earn. And it's programs like that, it's supporting schools, it's supporting the Financial Innovation Lab that we talked about, all sorts of things in order to try to promote financial education, because if we don't do that, people won't try and buy the products. But then we have to have the products to sell in the right form.
Yeah, I think that's important. So you have to put your money where your mouth is. You have to have the product that you're talking about. But so it's great programs, and I'm sure, Rod, if I asked you the same question, you talk about the programs that Voya is doing for financial literacy. Is it time, or is it worth the effort possibly to get all our industry groups, which we have many, including this great Geneva Association, is it possible to get our industry groups to lobby governments to maybe put it on the syllabus for schools? Is that possible, or is that just a pipe dream, it takes too long, or it's not worthwhile? Rod, maybe you want to hit that first?
Look, any of those initiatives are worthy of the effort, Ronnie. I mean, this country right now is a pretty divided country. Hopefully that whatever the outcome of our election is, I live in hope that might settle down a bit. But whether it's an industry group or whether it's through programs like this, which I think are highly valuable, or just the collaboration that many of us are having with, Charlie and I speak on a frequent basis. I think it's highly valuable, and I know he does with many others, as do I. Ronnie, just to pick up on a point Charlie made, and we're back a little bit to our children, but people will spend more time on choosing their weekly Netflix selection than they do on their benefit annual enrollment. And there's just, we need to reach them at a place and through a medium with tools. And Charlie's, Amazon example I think is a good one on how do they think about this, how do they process it, and how do we bring tools to them? The kind of tools he spoke about and others. And so whether it's an industry group, whether it's through this association or others, I think all efforts are critical. This education is important, as you just pointed out in the example you gave when we began. But people need access to that information. They need to learn it. They need to experience it, and they need to experience it in mediums that they're familiar with and comfortable with and will use.
Hey,
Thanks
Rod,
so much, Rod and Charlie. Oh, Charlie, go ahead.
You just gave me an idea. Maybe you and I could create a Netflix program called like Rod and Charlie's Crazy Financial Adventures. And
Awesome.
then we could get to the top of the list and then talk about financial literacy on Netflix.
I like it.
All I could tell you, Rod and Charlie, is it couldn't be any worse than some of the Netflix movies I've been watching in lockdown. So I think that's a wonderful idea. I'd be happy to sit on the exercise bike and listen to that for 40 minutes over some of the crap I've been watching. So thanks. Sorry, but I do have Netflix. So don't turn me off, Netflix. I do love it. We did get one question in from the audience, which I'll rephrase for you. And this is a balance between short-term and long-term needs. So people are, as you said, they're living paycheck to paycheck. How do you get them to focus on the longer term? And coming out of COVID might be a very unique, small window to explain about how important it is to think about your future. So when the next problem comes up, there's money. I'll give the example of my son in the US, who's a videographer, does the same thing as these fine people who are helping us with the technical equipment here. Pascal and Hannes are working very hard on that. My son does similar things. He was basically shut down for a while and had absolutely no income. How do you go to my son and say, think about the future when he's worried about his next meal, except he can always go to daddy and ask for money, but which he didn't. He was very good. But how do you focus on that? And then as they come out of the COVID-19 and things open up and they start making money, maybe that's, I think the questioner is saying, that's the unique time that you can say, remember what happened. You don't want to be in that situation again. Don't go off and spend, start to save. How do we capitalize on this is the question. So Charlie, you want to take that first?
Sure. I think you kind of answered part of it in what you were saying. I think you start with baby steps. Very difficult to go to someone who is, drawing down on their 401k because they have no other liquid assets and say, gosh, you should start saving. But when this turns around, and I am like Rod, hopeful that it will, and they start making money again, you could start with saying, why don't you create an emergency savings account? Why don't you do small things and baby steps at first, and then lead on to a more disciplined approach over time? But it's unrealistic to say do everything at once. But if you can begin to take small steps and create sort of a mentality and a discipline around the thought about savings, at least in my mind, that's a good way to start.
And Ronnie, I think that's well said, Charlie. And just using your son as an example, my son actually does something quite similar. We've talked about it before, but there's a whole host of people that are self-employed that naturally have been impacted in the industry, like your son has talked about. But how do we reach those kind of people and provide solutions? And I do think this pandemic, like every single one that we've been through in prior periods, helps shine a light on and raise awareness about that need. And of course, it will need to be baby steps, but I do think people's awareness and understanding have been heightened, and now we need to reach them how, when, and where they want to and need to be accessed as we go forward.
Okay, great. I think we're starting to come to the end of our time. I wanted to ask one final question, and then we'll end with that, and that is on a more personal note. So Rod, maybe we'll go with you so we can end with our hosts. On a more personal note, can you tell us just a small thing about yourselves that we might not know? And remember, Rod, I know you quite well, so it's got to be a good story. And please don't talk about being a Texans fan, because I just don't understand how that team decides not to play the first half and then comes out and plays and still thinks they can win a football game. And I have Deshaun Watson again as my fantasy football quarterback, and it's just not working. So not about the Texans fan. Tell us something else that we might not know about you that's would be of interest.
Well, I won't use a football example. Ronnie, as you shared, so I guess maybe you all do know, I started more years ago than I want to share on the distribution side of the business. And I did that for 15 to 18 years as an agent or a general agent. And that experience was extraordinary. In fact, I never had ambitions to do something different. In terms of the appreciation of and the respect for both distributors and these products and solutions that we create, what they really do for real families and real businesses. And so that experience never leaves you. And I think it's helped form and shape a lot of what I've tried to bring to the various roles I've had over a period of time, and certainly this one. So the passion that I have, and I know you can tell that Charlie has similarly, for what we do for and with our companies for our customers, is driven by those very early learnings and those very early experiences that I had many, many decades ago at this point. Okay, Charlie, before we get to you, we will get to you, so you have a little more time to think about it.
We do actually have a hand raised, and it's from OFL. That means our fearless leader, Jad Aris, who's the managing director of the Geneva Association. So, Jad, go ahead and ask your question. You're online.
Yes, hello. Can you hear me?
Yes.
Yes, very well. Well, thank you very much, Charlie and Rod, for this exchange of views. It was really fascinating to listen to both of you. We talked a lot about how to be a responsible financial institution, and I liked very much all the examples you've been taking, from repositioning your product portfolio to engaging your employees, and of course to all the contributions to society. There's one topic we haven't touched about. It's actually the investment side of your activities. I mean, both of you are massive asset managers. Prudential Financial manages $1.5 trillion US, Voya several hundreds billion dollars. How important are these sustainability or responsibility considerations in your investment strategy? And let me give you one example. In the previous panel session, we had a very senior representative from the WHO, the World Health Organization, who was pointing at, for example, the contradiction of being a major financial institution active in health insurance and life insurance, and at the same time investing in certain industry, for example, the tobacco industry. How important is this on your agenda?
Since we're a lot smaller, I'll start first. And it's a wonderful question, and it's really important. And again, companies, you kind of start where you started, but I think how one balances those decisions over time, particularly if you're focused on being recognized around the broad ESG elements that we've talked about, are very critical. I think they're really important, and you know, it's been a journey for us, but I do think you have to balance that, and I do think what we're seeing globally and what we're seeing certainly growing in the U.S. is an awareness and understanding of if you're saying this is important, are you in fact implementing it in that way, acting in that way, and making decisions consistent with those outcomes, and with AI and the automation of data today, the measurement of these things is unbelievable, and so it's not as if you can fake it. You know, if you're going to do this, you need to do it, and you need to act in that way. And look, none of our companies are perfect, and certainly Voya is not, and I want to be clear about that. But we really do try to act and implement in a way that's consistent with that approach and philosophy.
And the only thing I would add is that I think the U.S. is on a journey that Europe has been on for quite a while. There are industries we don't invest in. We are increasing our investments in sustainable energy and other things. So I think there is progression that will continue over time, but we're on that journey.
Thank you very much.
Thank you very much. I heard Jad from the other room say thank you very much, but I didn't hear it on the speaker necessarily. So he does thank you. And Jad, thank you so much for that very, very important and insightful question. We do appreciate that. So we'll end up, Charlie, back to you for one final comment on something that we don't know about you.
Okay, well, I'm gonna end up where Rod did, but what you may not know is I started my career not in the insurance business, but as an architect, right? And my wife is bitter about this because she's an architect, and she married me when I was a long-haired, blonde surfer from California who was an architect and ended up with kind of a bald banker kind of finance guy, and says it was a huge bait and switch, but which it was, but that's what happened. What I want to emphasize is what Rod said, and he made just a tremendous point. And what I've learned at my time at Prudential, and both in the US and overseas, is the importance of what we do and how it absolutely affects people's lives. And the purpose of being able to provide financial security and peace of mind to people for many situations which are terribly difficult for them. If a loved one dies, or if they're in retirement and they're running out of money, what we can do to help them is profound. And when I first came into the industry, I just didn't realize how much we affect people's lives. And that purpose and that role we have has made a tremendous impact on me over time. And that's why I love the industry. That's why I'm so passionate about it, is because what we do does affect people, and it affects people positively.
Well, great words. And let's just say from my knowledge of the industry, and Rod, I know a lot of people, the industry loves both of you back. So you're both doing a phenomenal job with all these aspects. We talked about low interest rates, diversity and inclusion, COVID-19, the environment, life insurance of the future. And we also got a great question from Jad and talked about investments. So I think we covered a lot of ground. I really do appreciate your time. Once again, Charlie, thank you so much for hosting us on this. I really wish it was in person. I'm a big lover of Newark and the history of Newark, especially photography and for art. Newark is for artists, and I'm a big fan of that. So it would have been great to show off, but maybe we'll do that again in the future. If not, Amy Kessel said she's going to just cook for everybody who comes to her door, so we don't have to worry about that. And Rod, I hope to see you soon, maybe next year in Las Vegas again if we have our event, and maybe we'll drag Charlie along. I'll sit you next to each other because it looks like you'll fight the whole dinner. So we'll do that. Once again, sorry for wearing a tie. You both look great. I'm really happy to have you, and thanks for all you do through your companies for the industry. Thank you again.
Thank you, Ronnie. Charlie, thank you very much.
Yep.
Bye-bye.
Rod, thank you. Ronnie, thanks.
Okay, so I hope you were all as excited about that session as I was. Just sitting down with these two industry icons is just amazing. I'm not going to take a lot more of your time in summarizing, as I did summarize the conference. I do want to just emphasize our appreciation for Prudential Financial. It's a great company. They're a member of the Geneva Association, and they have been supportive for so long. And when I met with the team and said we're looking for someone to host our 2020 Health and Aging conference, it took absolutely no time for them to agree to do it. So they're really big supporters of the Geneva Association, the industry, and you see what great things they do for the industry. And of course, Rod has been my friend for so long, so it's just always a pleasure to sit with him as well. We've had the 2 days, the half days. We hope, first of all, you will get, if you're an attendee here, you will get a recording of this. Please stick to the Chatham House rules on this, especially on this last session. But you will get the presentation, the entire presentation on a recording. I will make a small sales pitch for the Geneva Association. If you're from a member company that does not belong to the Geneva Association, please call the conferences team. You have the information. Please send a note to the conferences team and say, I'd like more information. It is a CEO-driven organization, so the CEO is the member, not the company. So you do have to talk to your CEO about that. But it's just a great organization under Jad's leadership. It's adapted so well in the COVID environment, going to these virtual conferences, hiring the great tech team of Pascal and Hannes to do the work for them. And they do hope to get back to in-person or at least hybrid meetings sometime next year. We're really hoping for that. So it's a great organization. And there will be forms that are sent out. The conferences team, Nadej, will be sending out a form for you to rate the conference. Please rate the conference kindly. I think they get bonuses based on how well it does. So no, but we do want your feedback. So please give us the feedback. And on behalf of the Geneva Association, we wish you a great day in North America, in Europe or Africa, in Asia, if you're still up. Thank you very much for being up. And from me, Ronnie Klein, I hope to see you soon.